This is Dr. Nwiloh Heart Foundation. So this section is the ECG section, EKG section, where we need to examine the football team. We are here in Bayelsa to examine their football team, especially those who have chest pain. And we have our questionnaire here, where we'll be screening those team players on whether they have high blood pressure, they have murmur, they have irregular heart rhythm and palpitation. So the questionnaire carries a lot of tests, examination we conduct on every team player here. So we also do blood tests and all of that. So if a player is qualified for an EKG and the player is in line with the questionnaire, and maybe from any of those questions is yes, so we can conduct an EKG. So we have a patient here that want to conduct an EKG on, and this patient BP is actually very, very high. We have a systolic of 185 and diastolic of 104. So let's actually check the electrical part of this patient heart. That's what we want to do now. So the first thing now, we swap. We're going to swap with alcohol, so we have good electrical reading. So this way. So these are the electrodes. So we stick the electrode on the chest, 40 intercostal space. The electrodes have to enable electrical conduction to go through. So you can use the leads. So electrical charges will have to go through the lead to the EKG machine. You understand? Because the body has charges, what we call impulses. So that is the work of the electrode, to allow for electrical charges to move to the machine, so that the machine can interpret and diagnose what is wrong with the electrical part of the heart. So you can help me to put that. So the leads are connected to the electrodes. So we'll move over to the machine where we want to get the reading. So as you can see, you start seeing the reading moving. This is the electrical reading of the heart. You understand? So when the patient is properly stable, you go back to the patient and tell the patient to calm down. It's not going to shock you. This is what we call quality control. The patient has to calm down so that you have to minimize artifacts. We have muscle tremor artifact, electrical artifact. So when you calm the patient down, the patient has to relax, that these electrodes or these leads are not going to shock him. So the patient has to relax so that you have a good trace of the electrical reading. from the machine. So as it is now, we have a very good reading, and we are going to print it out. You understand? So when we print it out, the printout is what we call the electrocardiograph, which is the result, what we got from the electrical part of the heart. You understand? So now we're going to print. So this is the electrocardiograph where the patient result is printed. So on this result, we're still going to interpret it and explain to the patient later what he or she has to do and shouldn't do. Thank you very much.
All right.